Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society produced by HCP Live. Hosted by Skin of Color Society leaders, Skin of Color Savvy delves into the latest research, clinical insights, and other news important to skin of color dermatology, featuring highly recognized experts in the field.
I'm Dr. Mojgan Hosseinipour, a board-certified dermatologist and clinical research investigator practicing in South Florida, with a clinical focus on skin cancer, ethnic skin, and procedural dermatology. I'm proud to be a SOCS member, and I actively serve on our Media Relations Committee. Through Skin of Color Savvy, we're here to provide dermatologists and healthcare providers with expert perspectives on treating patients with skin of color, advancing care, and celebrating diversity, and making a meaningful impact together. So let's dive in.
Sounds good. So, Dr. Hosseinipour, with your dermatology practice in the greater Miami area, you must see a lot of diversity in your patient population. When it comes to your patients of color, what are your top concerns you treat, and what are the biggest myths you sort of help to debunk?
That's a great question. In my dermatology practice, I see a rich diversity of patients, including many from communities of color. One of the top concerns among my patients of color is hair loss, which can manifest in various forms such as traction alopecia or more generalized thinning. This can be particularly distressing because hair is often seen as an important part of personal identity and cultural expression. Alongside hair loss, pigmentation issues are also common, including conditions like melasma and post-inflammatory hyperpigmentation. These issues can result from a variety of factors, such as hormonal changes, skin trauma, or sun exposure, and patients of color are often more prone to these changes due to the higher melanin content in their skin. When it comes to myths about dermatologic care, there are a few that I frequently address. One of the most persistent is the idea that patients of color cannot get skin cancer. This is a dangerous misconception because while skin cancer is less common in these individuals, it can still occur. Additionally, the cancers that do develop may be detected at later stages, which can affect the outcome. Another myth is that people of color don't need to wear sunscreen. This idea likely stems from the fact that darker skin has more natural protection against UV rays. However, even though darker skin offers some level of protection, it does not eliminate the risk of sun damage. Sunscreen is essential for everyone, regardless of skin tone, to prevent premature aging and reduce the risk of skin cancer. Educating my patients about these concerns and myths is a critical part of my practice as it helps them make more informed decisions about their skincare and overall health.
What kinds of studies are you involved in, and what are your thoughts about how to bring more people of color into clinical research?
So I've been participating in clinical research for the past 4 to 5 years, and my studies have ranged from skin cancer treatments to acne. I focus on a variety of dermatologic conditions, and my current trials include vitiligo and atopic dermatitis studies. These conditions can have a significant impact on patients' quality of life, and my research aims to improve treatment outcomes and deepen our understanding of how these diseases manifest, especially in diverse populations. So in particular, vitiligo, a condition that causes depigmentation of the skin or loss of skin color, can be especially challenging for patients of color as a loss of pigment is more noticeable. My work explores how different treatments can improve the condition and help restore confidence in these patients. Atopic dermatitis, more commonly known as eczema, is another area of focus. It is often chronic and can be associated with flare-ups. My studies in this area aim to identify more effective therapies that are safe for all skin types, as the condition can present differently in people with darker skin tones. I'm particularly interested in understanding how treatment efficacy can vary across diverse populations and how we can tailor therapies to be more inclusive and effective for everyone. When it comes to bringing more people of color into clinical research, I believe the key lies in improving access, education, and trust. Historically, certain communities have been underrepresented in clinical trials, which can lead to a lack of data that is reflective of their needs. It's important to create outreach programs that raise awareness about the importance of clinical research and addressing the unique needs of these populations. In addition, researchers and healthcare providers should make a concerted effort to establish trust and transparency, ensuring that patients feel confident that their participation will lead to better treatments and outcomes for their communities. Finally, it's essential to design studies that are inclusive by ensuring that diverse participants are represented in clinical trials from the outset. This includes recognizing the unique ways diseases like vitiligo and atopic dermatitis present in people of color and ensuring the research findings benefit all groups. By prioritizing inclusivity and accessibility in research design and outreach efforts, we can help close the gap and improve dermatologic care for everyone.
Mhm. Well, speaking of research, the Skin of Color Society recently presented its 21st annual scientific symposium in Orlando, held in conjunction with the American Academy of Dermatology annual meeting. Please tell us about it.
This year's symposium continued the long-standing tradition of showcasing the latest scientific research and insights from emerging researchers and leading experts from around the US and around the world. Covering a wide range of topics important to the global skin of color dermatology community, the program featured a fascinating lineup of invited speakers, expert panels, oral and poster abstract presentations, and a keynote session on health equity with New York Times bestselling author Dr. Uche Blackstock. There are so many highlights and takeaways to share. Let's delve in.
So I'm incredibly honored to be the incoming president for the Skin of Color Society. The organization is incredible as it stands with how many programs we have and how many spaces we work in, whether it's education, mentorship, advocacy, research. We have programming across the board. So, one goal will be to continue to sustain and grow our current programming. Another really important goal for me this year is service. I'm very passionate about service, and I really want to build out a service arm for SOCS. And, we do a lot of work that's already giving service to our community, but really formalizing some of those programs and really casting a wider net in terms of the programs that we do across the city, or across the country and across the globe. The other thing I really want to work on is global reach and global impact. The majority of the world is actually skin of color. So I would love to see our organization continue to grow in membership across the globe and to continue to have SOCS programming and representation in different places across the world. So really passionate about that and building out our global council and bringing together international organizations and really serving as sort of a connecting point for them. And then the last thing I'm really passionate about is just membership. I think that we have incredible members, and I want to continue to grow our membership and make sure that we're, working hard on efforts to retain our current members while recruiting new members.
Yeah, I mean, this meeting is taking place in a very different political landscape than we anticipated a year ago when we initially started planning it. And so we really want to emphasize all of the gains that really all patients and all physicians and all practitioners can see when we improve health equity, when we improve representation in clinical trials, when we start to tackle diseases that have been historically understudied or underfunded. And so even though we started planning in a different political landscape, I feel like the theme that we have just seems even more important and takes this added importance in our current setting.
Well, that's all for today. Thank you for joining us for this episode of Skin of Color Savvy. We hope you found today's episode informative and inspiring. If you're interested in learning more about the Skin of Color Society and its incredible work, visit skinofcolorsociety.org. Don't forget to subscribe to HCP Live's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. And we'll be back soon with another episode, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, take care and thank you for listening.
Thank you for having me.